We are back with pharmacist Dr. Brittany Blake with Cone Health Community Pharmacy talking about what medicine you should have on hand as kids head back to school. Doctor, as you know, injuries, they can happen really anytime. What are the must-have supplies for treating minor injuries at home?
Absolutely. So again, you want to have something for pain relief. Typically, ibuprofen is going to help with that inflammation. Having some ice packs, even have instant ice packs that you can have with you on the go. Just your basic first aid kit is really helpful. Having some sort of like ace bandage if there's any sort of wrap or something for a twisted ankle or something like that. And then having an antibiotic ointment, some sort of something to make sure that we're preventing infection where they take out a little scratch or scrape.
If you are hopefully one of the lucky ones and you don't have to use a lot of medicine all the time, you might be looking through your medicine cabinet and find that some of the things are expired. These expiration dates, do we need to take these very religiously?
Absolutely. Always, always, always check your expiration dates. I always tell my patients I want for them to keep the medication in the original bottle it came in because that's going to give you the accurate expiration date and it's going to make sure that you know that you're taking what that you're intending to take. So definitely checking those at least twice a year is really helpful to make sure that you're getting all of that cleaned out and you're only using things that are going to be effective and safe for you.
If you do find some expired medication, your first thought might be, well, I'll just throw it away or dump it in the toilet. I mean, what kind of advice do you have for properly disposing it?
You know, so many pharmacies, including our Cone Health community pharmacies, have drug disposals. So I always recommend if my patients have medication that's expired or they're no longer taking, I ask them to bring it in and put it in the disposal. So that way they're not going to accidentally take something that is expired or that they should no longer be taking, and they're keeping it out of the hands of children, pets, and things like that.
Are there any medications that you can just safely throw out or put down the drain?
Yeah. So definitely don't want to put something down the drain, but sometimes you can mix things with like coffee grounds or something like that. So it's not really mixed in. If it's a tube of a cream or something, you can toss those right in the trash. That's okay.
Got it. Okay. And so let's say the kiddos get sick and you go to the medicine cabinet to figure out what to give them. And oftentimes the medicine cabinet looks like a disaster has been through there. Any advice for organization?
Yes. So when I think about organizing a medication cabinet, I want to separate adult remedies from child remedies, and then even separate things based upon what they're being used for. So maybe cough and cold being separate from your first aid, antibiotic ointments, and stuff like that, and keeping it in the original container again, so you know what that you are using. And especially with those kid medications that might be in a liquid form, making sure that you have either the measuring cup or the syringe that came with it. A lot of times those are specific to the medication that they came with.
Oftentimes, people might think that pharmacists are only there when you need a prescription filled, but what are some other ways that someone in your profession can help throughout the year?
Absolutely. So pharmacists are a really great reference if you ever have questions around an over-the-counter remedy or you're not really sure if this is okay to take with the other medications that you may be taking. Drug interactions are very common, so pharmacists are a great reference for that. And especially as we are going into cold and flu season, they're also a great place to get vaccinated. So as we're coming into the fall months, it's definitely time to get your flu vaccine as well.
I'm glad you brought that up. We did a story last year and we have stories in the news today about the flu vaccine. Is this too early to get a flu vaccine for kids?
So I typically recommend to start getting the flu vaccine around September. I will tell you that I had a kiddo, one of my kiddos actually got the flu back in October, early October. So I do think making sure that you're getting it earlier in the season is better. We do start to see cases as early as the end of September, beginning of October. And it does take 2 weeks for your body to mount enough of a response to keep you protected from the flu.
So start thinking about it now. Dr. Brittany Blake, thank you so much for joining us today. All that great expert advice, we do appreciate it. We are going to post this on our YouTube page, so if you'd like to watch it in its entirety, it will be up there this evening.